Do you sometimes get confused that which chest physiotherapy technique should be applied in patient with respiratory condition? If yes, then let me simplify it for you. Patients having respiratory condition usually have secretion and rhonchi. So first you have to assess if the patient have a strong cough reflex or not. If the patient do not have a strong cough reflex, then percussion, vibration and suctioning has to be done. If the patient is having a strong cough reflex, then deep breathing and coughing should be done. Additionally, percussion vibration can be given, but cough should be initiated. So, share this reel with your physio friend who is scared of chest physiotherapy. And for more such content, please follow.